is it normal to be anemic or borderline anemic even after a couple years of remission from TTP? Well, in my opinion, it is not. So if the TTP is in complete remission, then we expect the disease in all of its manifestations to have resolved or normalized, meaning that the platelets should be normal. There shouldn't be ongoing hemolysis. If the ADAM-TS13 levels are normal, there is no evidence of a persistent disease. So an anemia that occurs in the absence of TTP should be evaluated further as to what could be causing it. Now, there are certain chronic illnesses that can cause a chronic anemia, and that could be an underlying factor that may or may have been associated in this case, but in general, any anemia without active TTP should be appropriately worked out. So you should talk to your doctor about completing a good evaluation of the causes.
Yeah, I completely agree. I've noticed several of my patients after TTP, particularly if they've had a great, significant amount of anemia during their TTP episode, where they lose iron, can end up iron deficient. Yeah. So I've had several patients need treatment for iron deficiency anemia. And like you mentioned, particularly if TTP is an isolated disease and in remission, there shouldn't be any anemia. Everything's going to go back to normal. But sometimes TTP comes as part of other diseases, either related or unrelated, and sometimes people develop anemia from other chronic conditions.
Right.
So certainly I wouldn't, just chalk up your anemia to the fact that you had TTP a few years ago. It's worth talking with your doctor about what are the reasons I might be anemic. Is it another disease I have, or is this a lingering effect like low iron